Hi, everyone. I'm Heather Bouchard, and today I have the pleasure of speaking with Dr. Aaliyah Snyder, who is a clinical assistant professor in the Department of Clinical Health and Psychology at the University of Florida. She is also a project scientist with the UCLA Brain Sport Program. Clinically, Dr. Snyder directs the neuropsychology arm of the interdisciplinary TBI clinic at the UF Health Norman Fixel Institute for Neurological Diseases. She also directs the Holistic Interventions for Brain Health and Recovery Clinic. Dr. Snyder will be speaking at the upcoming SNS Symposium, giving a talk titled Autonomic Dysregulation in Persisting Symptoms After Concussion, Bridging Brain, Body, and Behavior. Dr. Snyder, thanks for being willing to speak with me today.
Thanks so much for having me, Heather.
To start, can you explain how you conceptualize the mechanisms behind autonomic dysregulation following a concussion?
Absolutely. These are evolving mechanisms that we're understanding, but um, we know that in traumatic brain injury, especially on like the moderate and severe end, it's been very obvious that there is autonomic dysregulation that comes along with it. In the extreme ends, some of that dysregulation in temperature control, blood pressure, cerebrovascular perfusion can contribute to mortality afterwards. But more recently, I'd say in the past maybe 10, 20 years, we started gaining appreciation that this also happens on the milder end of the injury spectrum. Um, and what the mechanisms are, there are a couple different ideas. One, it could be biomechanical. So the central autonomic network in the brain is really distributed. It's everywhere. There's a lot of important connections, and it's not as simple as some of the other, or maybe as kind of as pared down as some of the other brain networks. And so any kind of disruption to kind of the functioning of the brain is going to impact autonomic regulation. But then more specifically, we know that the HPA axis is particularly vulnerable after concussion to dysregulation in functional connectivity, in signaling, and so that's another area. But then there's also along the HP axis, the neuroendocrine impact. So hormonal signaling is very kind of tied in. Neuroendocrine is kind of the umbrella, and autonomic nervous system sits within that. So kind of biomechanical, inflammatory, functional systems. But then we also know that there's feedback loops between behavior and cognition that interact with autonomic nervous system regulation.
That is all really interesting. Given what you mentioned about endocrine functioning and hormones, do you see a difference with gender or sex related to autonomic dysregulation in patients?
I think this is a really interesting area because for a while we've known that women, females are more prone to kind of persistent symptoms, more severe symptoms. And the autonomic nervous system, neuroendocrine systems may help explain that because we know that if you sustain a concussion at certain time during your menstrual cycle, your concussion recovery can be longer or shorter, that there are certain vulnerable periods. And we also know that women's autonomic nervous system functions a bit differently than men do, largely as a result of kind of the hormonal overlay that's going on. So I think that there's some really interesting questions and that need to be answered, especially about how women recover and sustain injuries that include questions about autonomic and neuroendocrine systems.
Yeah. Given broadly the symptoms that patients report, are there certain symptoms that you think are more clearly associated with autonomic dysregulation?
Well, autonomic dysregulation has really non-specific symptoms. So even folks who have degrees of autonomic dysregulation that don't have a concussion often have a lot of overlapping symptoms, like headache, like sensitivity to noise and sound, and light. Um, Conditions like migraine also are known to feature autonomic dysregulation. That's kind of part of the system. But some other symptoms to look out for that really signal autonomic issues is dizziness when standing, especially if you've been sitting or lying down, called this kind of orthostatic intolerance. Those kinds of lightheaded dizziness. Also, autonomic has cognitive manifestations as well. So changes in attention, kind of changes in working memory that can maybe relate to autonomic nervous system functioning in certain conditions too.
It sounds like it just broadly can affect a lot of different ways that patients just kind of interact with things or experience. Are there other risk factors? I know we talked about being a woman and female sex, but are there other risk factors that come to mind?
So having a condition that comes along with differences in ANS functioning before you have the injury is a risk factor. We know maybe not because of the ANS dysregulation, but maybe that's part of it. So those kinds of conditions would be like migraine sufferers. So we know that folks who had migraines before injuries really struggle with migraines and even more broad symptoms after concussions. I have some ideas, and I think others have some ideas that anecdotally hypermobility syndromes tend to potentially struggle a bit more. Folks with ADHD and autism, their recovery profiles may look a bit different, although there's not a great amount of kind of consensus research on that at the moment. I know clinically that's certainly something we see in our program quite a bit. So those are kind of conditions that also come with baseline differences in autonomic regulation, but then also things like trauma, autoimmune conditions. Those are all things that we know can interact with kind of the concussion and the recovery experience.
Sounds like there's a lot of different areas for research to move in the future to understand this more. What about interventions? Are there ways to kind of treat this? Have you seen, people respond differently in ways to different types of treatments?
I think this is how we got to the place where we understood that the ANS system was so important was because of John Leddy's work, among others, who really saw, okay, well, we know multimodal rehab seems to be the most effective, but what are the ingredients? And John Leddy and the Buffalo Group showed that if you can use graded subthreshold exercise to kind of recondition the system, that helps the autonomic nervous system and has been some of the most successful, especially for patients in the chronic period of time. There have been trials that have looked at heart rate variability biofeedback and concussion and have shown some promising results, potentially even vagal nerve stimulation. Our clinic at UF, the one that we built here, is a neurobehavioral therapy intervention designed for folks who are struggling with persistent concussive symptoms. And we kind of take this autonomic umbrella approach. The autonomic nervous system is so broad that it's hard to even say that it's one thing because it's not. But it's been hypothesized as the final common pathway of most successful therapy, regardless of approach, psychotherapy especially. So we focus on something that unites kind of the physiology of concussion and then also the cognitive, emotional, and behavioral experiences afterwards. So by kind of using the autonomic nervous system as a psychoeducational framework, it allows patients to engage with breathing, mindfulness, looking at how behavioral avoidance and endurance behaviors to help to encourage recovery. But I think the common thread is that multimodal rehab seems to be the most effective, that addresses treatment symptoms together, but vestibular therapy, occupational, physical therapy, we think the kind of cognitive and emotional and psychoeducational set is really important. But the ones that seem to be the most successful have reasons that they would be affecting the autonomic nervous system as well.
Sounds like the perfect position for a neuropsychologist to be in and with all those collaborations.
I think so.
Well, Dr. Snyder, thank you for speaking with me. And I know we're all going to look forward to learning more about autonomic dysregulation and how it relates to symptoms at the SNS Symposium in Cleveland this May. So, for those listening, they can read more about the conference and register to attend at the SNS website, which is the sportsneuropsychologysociety.com. You can also follow SNS on Facebook and Twitter. So thank you so much for chatting with me today.
Looking forward to seeing you there. Thanks, Heather.